we go over into English. Angus, please come forward, because you're going to tell us that we can have plans as much as we want, but there are always people that don't want us. And that's the thing you're going to talk about, the desinformation or misinformation or whatever you think is the best term. Angus is a long-term friend that has been working in industry, but also in the WHO, and now has his own firm, but he's also working in the University of Louisiana, is it?
Indiana,
sorry. And, but also always in the field of information and disinformation.
Thank you, Ted. Good afternoon, everybody. So, yeah, I'm going to stick to English because my Dutch is a bit rusty. You've heard a lot about viruses and vaccines, about programs and policies. As Ted's just told you, I'm going to touch upon another part of vaccination, people. And in my career, I've studied viruses, I've studied policies and programs. And believe me, if you think viruses are complicated, try studying people. So what I want to do today is show you that just as we saw in the first presentation, that we can understand the viruses through study, through data. We can understand how they spread and infect and how we can develop and implement vaccines to prevent that. We can also study what's driving people's decisions to vaccinate with the same rigor. We can study how misinformation spreads and infects with the same rigor. And therefore we can implement interventions that are effective based on what we understand through those studies. So I'm going to take you fairly quickly through the field. And as Ted touched upon, I'm going to focus on misinformation today, which is one piece of this rather large puzzle. But I guess if there's one thing I'd like you to remember today, Andre told us, if my rusty Dutch isn't letting me down, that vaccination is one of the most effective and successful interventions in public health. It's one of the most successful and effective interventions in public health if people get vaccinated. And so my case today is that we must invest time and energy and resources in making sure that we understand why people are not getting vaccinated. We need to move past this place where we were 10 years ago when I started studying this subject, where it was just throw our hands up in the air and say, why won't people vaccinate? We need to move past that to understanding that people have perfectly good reasons to question vaccines. They have concerns. They're exposed to misinformation. And as those of us who work within programs are responsible for ensuring that we address those concerns and questions, that we understand the misinformation that people are being exposed to, and we help them get past that. I'm going to finish my presentation with one of the most exciting findings that I think I've come across in my entire career, and that is that we can inoculate people, we can vaccinate people against misinformation. But let's start very quickly with what's going on when people are wondering whether or not to get vaccinated. First of all, what we want to call vaccine hesitancy or confidence exists along a spectrum, and people move up and down this spectrum. I may be hesitant about one vaccine, but not about another. I may refuse one vaccine, but be open to getting another. And that may change over time within my own mind, within my community, etc. It's a fluid state of motivation. Secondly, it's extremely complex. Each of these boxes represent known social, psychological drivers of people's decisions to get vaccinated. It can be happening at a more superficial level in our thoughts and our feelings, our attitudes. There are cognitive biases or heuristics that can affect our decision. But it can also be affected by things more deeply embedded within our identity. Trust, our trust not just for vaccines, but for the health system and the government that provides it. Social norms, our fears our experiences, even our certain moral values. And it can touch, as I've said, our identity. And what we've seen at this end of this pandemic, and I'm not sure we're out of it yet, but it seems like many of us want us to be there, is that some of these factors have become more important or have emerged as having more weight. Trust is fundamental, and we've seen that the way that countries managed the pandemic had a huge impact on public trust and eventually on uptake of the programs that they put in place. There's a moral value, liberty, that we've shown previous to the pandemic was related to what some people's decisions, and we've seen this emerge, and I'll show you some data from the Netherlands that suggests to me that this was rather important here at least a year ago. Political affiliation has emerged. This is catastrophic for me. We never had this prior to the pandemic. There was limited evidence to suggest that people were deciding based on their political affiliation. That's all out the window. And we have this selective vaccine hesitancy. People are now saying, well, I want this COVID-19 vaccine, but not that one. What does that mean for influenza vaccination and for other programs? But what I'm going to focus on mostly today is disinformation, but most importantly, also information gaps. Because disinformation only gets traction in those voids, those gaps where there's not sufficient information to address people's questions and concerns and their perfectly natural information seeking that they do. A very important definition or distinction, because this touches upon what we can actually do about this problem. Misinformation is unintentional falsehoods, wrong or misleading information. It can dilute the conversation online, offline. It can distract us. It can distort the conversation. Disinformation is something different. It is deliberately, carefully engineered falsehoods that are circulated with malicious intention using deceitful tactics. The objective of disinformation is to attract your attention, to stick in your mind. It is psychologically sticky, and to spread, to get you to share it. And the authors of disinformation know this, and they know how to do this very well. And they usually have one of three motivations. They're either monetizing, politicizing, or polarizing. It's almost always monetizing. But they've all got something in it for them. There's this term psychologically sticky, which always makes me think of like chewing gum under my shoe. But psychologists, cognitive psychologists, say that misinformation is indeed sticky. Once we see it, it's hard to get it out of our heads again. One of the reasons is that they deliberately use outrage to get our attention. And when we are a little bit outraged, we're more likely to click on something, to read something. But when we trigger these emotions of anger or fear, we're also more emotionally open to adopting what we read. There's this idea of illusory truth. In fact, the more we see something, the more we are likely to believe it. And so that's why misinformation, one of the aims, is to spread as far as possible and for people to see it over and over again. And it's often well designed to just fit within the way that people see the world. And if it's able to do that, for example, I have a fairly natural outlook on life. I eat organic food. I've got solar energy in my house, and I don't put any toxins or unnatural things in my body. Boom! If you can shape your disinformation to fit within that worldview, it sticks really well. So one study showed that it was literally 10 times more emotional, and importantly, when we get to what we should be doing about this, just easier to process. It just uses simple language, right? So that we digest it rapidly. So it's sticky. It can stay in our heads, and it can continue to influence our thinking even after we've been corrected. So this takes me to our first little take-home message. Facts don't change minds. We can try to correct people, we can throw facts at them, but it's not sufficient to change minds, especially a mind that might already have some of this sticky misinformation in it. So in the work that I did with UNICEF as senior social scientist over the pandemic, I developed a global program for social listening with an aim to support countries to develop a misinformation management strategy and mechanism. And we developed a framework, we published a guide that, I mean, you can all have these slides afterwards. And within that guide is a framework which we think is the way this should be managed within a country. I'm just back from Ghana, which set up a fantastic misinformation management mechanism over the pandemic, helping them to think about how they can transition it from COVID-19 into routine immunization. But I'm just going to follow a couple of these steps to take you through some of the things we can do to tackle, in particular, mis and disinformation. This listen, understand, and engage. First of all, listening in to what people are talking about. So the output of this is the Vaccination Demand Observatory. This is a global collaboration. You can go to the site. We are tracking misinformation in a number of countries around the world and providing misinformation alerts. And so I asked my colleagues who are at the public good projects in the US and not-for-profit in the US who have been doing the social listening, vaccine social listening for the US CDC and for public health departments across the US and now in Canada throughout the pandemic, indeed before that. I asked them to do a retrospective analysis of the conversation around vaccines in the Netherlands through the pandemic. So using tools that we have available, but also tools that are managed by very smart people who've been using them for years and years and know how to calibrate them and to use them well. We interrogated a very powerful system that allows us to search online information. And so one caveat is social listening should never only be online, because many, many conversations are going on in communities that are offline, and any program should be listening to that as well. But today we're looking at what we can do online. We interrogated the system in Dutch and English with keywords, Boolean search strings, words that we've used for vaccination, for tracking vaccination conversations for years now. Picked up over 100,000 mentions over the period, more or less, of the pandemic. But so what? Well, we started to cluster those into themes that we've already built out over the pandemic. We saw, in particular, these themes on the right-hand side there. Side effects and injuries was a big one. We saw hashtags emerging related to that. We saw people having concerns about some of the adverse events related to the vaccines. Perfectly reasonable. Why not? We saw, in particular, at one point, 4 out of the 10 most common hashtags were related to mandates, vaccine mandates. I'm sure many of you remember what happened in the Netherlands there, big pharma, etc. But this is what the conversation looked like. Now, this is a retrospective analysis. This is not very helpful. What's helpful is to do this in real time. But I asked them to do this to show you what's possible. So we clustered the mentions that we identified by these themes, and we could see peaks of different themes. When was it? In Q4 of 2021. There were protests here. There was a lot of discussion around vaccine mandates. Many people in the Netherlands latched onto that fantastic truck convoy in Canada. They were driving for liberty. There we have a moral value, the liberty moral value, that seems to be very important for many Dutch people. We see other peaks there. My point here is not to get into the details of this today. It is to say any country, if they're serious about managing this part of their vaccination programs and potentially more broadly their other public health programs, can be doing this in real time, can be detecting these issues in real time, and can be responding to those issues. In Ghana, there was a mechanism whereby the task force would identify issues every fortnight, would suggest responses that went to the health promotion teams and other teams, so the health promotion teams at the ministry, but also to the EPI media team, to community organisations, etc., to try to nip in the bud some of this misinformation. How is it then that we can nip misinformation in the bud. I'll come to that in a minute. The other thing we need to be able to understand, so I've talked about what we can hear, what people are saying, we also need to understand what's going on in people's heads and their hearts, right, when they're thinking about vaccines. Now, over a couple of years, I was part of large studies in, we got to about 16, 17 countries that asked people lots and lots and lots of questions about vaccination, in particular influenza vaccination. We asked health professionals and we asked the general public. And we learnt a lot because we understood the things that were actually linked to people's intentions to get vaccinated against flu, were linked to their actual influenza vaccination behaviour. Now, I'm not going to get into the details today, but something we learnt that was very exciting and I think needs to be applied to all of our communications is that a number of factors that bubble to the surface actually come together in a model that we've already been using to understand how people manage fear. If we are presented with a threat, we immediately think about how we can cope with it. If we're presented with a solution, we immediately think, well, what's the problem? In terms of the threat, we don't calculate risk. We feel it. And what we found was that people need to feel susceptible to the threat, in this case, influenza disease. Susceptibility means that I feel vulnerable. I am vulnerable personally to this, and there's a chance that I'll catch it, right? Not much point selling somebody volcano insurance if they live in Holland or France, right? The threat has to be real for them. They have to think that it's possible. But at the very same time, they're also saying, what can I do about this? And so we must communicate to them in parallel the coping mechanism, in this case, vaccines. And when we present that to them, people will be saying, well, does it work? Tell me if it works. What are the costs for me? Is it safe? But really importantly, can I do it? Can I go and do this? How easy is it for me to go and do this? Because if it's too difficult, I'm not going to do anything. And what we find is if we overdo the threat, people either don't respond at all, or in fact, they will react against any solution that we present later, what's called maladaptive coping. So we've got to get this nice balance if we want people to cope correctly and get themselves vaccinated. I'm not going to talk about programs today, we don't have time. I'm going to talk about misinformation. I could talk a lot based on what I've just told you and on other work that I've done about how we should be communicating generally proactively with people. This is the algorithm in the guide that I wrote and that's being used by a number of countries in their social listening programs. If they identify gaps in information, so people are looking for information and they're not finding it, they should be proactively putting the information out there, shaping the agenda, getting a lot of stuff out there, but getting it out there in the form that is engaging and relevant for people. If we were to summarize how we should communicate around vaccines in one sentence, it would be we should talk with people, not at them, where they are, both physically and mentally, about what matters to them. But we don't have a lot of time to go into these things today, so I'm going to look at the other two things, and in particular the far one. So when the teams in countries that are evaluating the misinformation that they're detecting evaluate it as low risk, and this is using a matrix that we've developed, we have an approach called psychological inoculation or pre-bunking that they can engage in, and I'm going to talk to you about this today. If they put it as higher risk and there's a specific misinformation narrative that's circulating, then we can also debunk specific myths. But it's very important. You remember when I told you how misinformation is sticky? We need to be careful that we don't just repeat the misinformation over and over, because we know that people may confuse that with truth over time if they hear it more and more. This backfire effect is maybe less significant than we thought originally. There's some data that suggests it's less important, but we still need to debunk with care What I'd like to talk about mostly today, in the last few minutes, is how we can inoculate people against misinformation in general. Just about shaping the agenda, we need to design context-driven messages, right? The messages must fit the context. They must be relevant, they must be attractive to people, they must answer people's questions. They must speak about what matters to people, not what matters to us. They must be culturally appropriate. This means doing the work. This means doing the focus groups. This means doing the co-creation of the content and testing of the content. We have a large program that's going on in 7 or 8 countries with Meta, formerly known as Facebook, UNICEF, Public Good Projects, and Yale Institute of Global Health, where we're doing this, but then rapidly testing the content on the Facebook platform to see what works, what gets people's attention, what's answering their questions, what's making them feel, what's increasing their trust in vaccines, before we actually put it out there in the wild. And there's a guide that's been developed with Yale Institute of Global Health that has a number of principles, but today what I want to focus on is 2 of these. One is credible messengers, and 2 is how do we bust myths, or how do we inoculate, more importantly. So just, there's so much we can say about this, but it's absolutely fundamental. The messenger is as important as the message. The messenger is maybe more important than the message. Now here's something that I learned a couple of years ago. We can't understand everything in the world. There's too much stuff to know. So we get our information that we incorporate into our decisions and our beliefs and the way we view the world from people that we deem trustworthy. Not trusted, but trustworthy. And this is an interesting construct. People who are trustworthy are people that we believe are experts. They know what they're talking about, right? I mean, that makes sense. And they're competent. They're good at what they do. They really, they do their job well, and that gives them credibility. But most importantly, I need the people that I get my information from to have my best interests at heart. I need to feel like they care what matters to me. I need to feel like they are benevolent or compassionate. We talk about this over and over in risk communication, acknowledging people's concerns, acknowledging their fears, connecting with people. It is fundamental. Now, we've heard about the importance of vaccinating health professionals against influenza. It's fundamental because, one, they're more exposed, or they have potentially higher exposure, so they're at higher risk of contracting the disease. Second thing is that they are in constant contact with vulnerable people. So from an epidemiological perspective, it's absolutely fundamental. But there's another key point here as well. If there is one group out there that almost everybody in the world trusts, it's their health professional. It may be their GP, maybe their paediatrician. It may be the frontline health worker in rural West Africa. But people trust those people. Therefore, if they're not getting vaccinated, if they don't believe that the vaccine works, if we're not equipping them with what they need to be able to have those difficult conversations around vaccines, then we are likely going to fail in our campaigns, in our ability to reach and address people's concerns, because they are the most trusted voices. They're not the only ones. Community leaders, religious leaders, it depends on the community that we're in. But a lot of the work tells us that they're fundamental. And so we shouldn't just be vaccinating them to protect their patients and themselves. We should be giving them the tools that they need to have those conversations, because they are the multipliers of trust in vaccines in our communities. Okay, so let's spend 3 minutes on pre-bunking. Debunking is, as I suggested, reactive. We get a specific myth, we think we have to address it, we go out and do something. We don't have time to talk about it today. There's a formula, it's in the guide. I want to talk about pre-bunking. This is like a generalized vaccination campaign against misinformation in general. It's predicated on the idea that, as I've touched upon already, disinformation is being spread by bad actors who use deceitful tactics and have malign motives for spreading it. We can help people to identify those tactics, or tricks is the word that we identified in East Africa as being more appropriate. The tricks that they're using, but also those motivations. They're in it for the money. We can help people to identify, first of all, misinformation in general, but also to start to identify the way that they're being fooled by these actors in the disinformation that's being spread. And when we do this, we know that we can increase people's resistance to misinformation. Misinformation in relation to vaccines, perhaps, if that's what we're focused on, but also more broadly. These messages basically have two things. They have a warning, a heads up, there's misinformation coming. So before we repeat the misinformation, we tell people, there's misinformation on its way. Alert. And then we show them how those arguments are being used to try to fool them. Now, we set up a program last year with John Cook, who's at Monash University in Australia. As you may have identified where I'm from. Not Monash University, but Australia. John has developed a game. He's a cognitive psychologist who's developed a game that's on a smartphone. You can download this right now. Focused on climate change, misinformation. And we are currently with UNICEF and the Savin Vaccine Institute developing a vaccine module. Now, this game uses humour and cartoon characters to help people build resilience to misinformation, but it does that by exposing them to misinformation and to those tactics, those tricks that are being used. The process is more or less like this. We provide up front a replacement fact before we even mention the misinformation. We show the tactic that's coming, and we've identified the most common tactics being used in vaccine misinformation. We provide an example of that tactic to help people understand, to illustrate it for people. And then we encourage them to think a little bit more critically about everything they see. We give them a little quiz. And they go through different tracks for each tactic. We've, in the last 2 months, we've been co-creating this in East Africa. We're hoping to be doing that very soon in West Africa in French. We're taking it to Pakistan. There's interest in Australia. We've certainly seen that a game like this, you need to make it culturally relevant. The characters need to be relevant. But the general principles are the same wherever you go. So, let me summarise. Misinformation and more broadly decreased or eroded trust, public trust, is a major threat to our immunisation efforts. It always has been and it always will be. So the question now is, which countries are going to step up and start investing in preventing, in managing these challenges so that the vaccines that are in the fridge don't stay in the fridge where they're 0% effective. They get into arms where they're protecting people against diseases. And there are clear solutions. We know what can be done now. It's no longer an excuse to throw our hands up and say that people are stupid. We have clear principles for how we should be developing the communications, the way that we speak with, not at people, about vaccines. We can vaccinate against misinformation. My vision is national immunisation programs against misinformation. I mean, Finland has had critical thinking in its school curriculum for 10 years now. It is the country the most resistant to misinformation in the world. We are already getting very great interest in introducing this in school curricula. And where necessary, we can tackle specific myths, but that should be done with care. And this should all be wrapped into a national strategy and mechanism, as I've touched upon in Ghana and in other countries. This has to be joined up. We have to be listening to people's concerns online and offline and detecting the misinformation. We have to be thinking about what's going to be important and what's not in terms of its impact on people's attitudes. And then we have to be working with the people who are in the communities, who are communicating with the media and directly with communities, to provide them with responses and proactive information and inoculation messages so that they can be constantly providing the kinds of information, the kinds of communications, the kinds of engagement that people need to get past their concerns and questions and fears and decide to vaccinate. Thank you very much.
Thank you, Angus. It's not enough to have good vaccines, it's not enough to have a good vaccination system, but we need a very good information and inoculation system for information, I guess. And that's the lesson I've learned. Any remarks from the audience or questions? then we'll think about it during this short break